Children and youth have the right to health in the sexual and reproductive realm. This from the Family Planning Association of Trinidad and Tobago as it released its annual report to the nation emphasizing the right to health. Marie-Therese Bernard has more.
The Family Planning Association of Trinidad and Tobago, that's FPAT, says it's working hard to improve sexual and reproductive health for youth. Head of the organization, Professor Marie-Therese says children need access to information on sexual reproductive health. She argues that the information protects the vulnerable children and empowers them.
If young people are regularly having sex at ages far below 18 or even 16, it must be demonstrated that it is not only reasonable, but our duty as policy makers and service providers to protect them with appropriate information, education, and services.
She notes as well that hard facts and data need to be gathered in the fight to increase reproductive health.
In the move to change, there's a dire need for disaggregated data. And that is so for funding, it is so for winning the arguments with governments and policymakers. Do we know how many people drop out of school because of discrimination and stigma? Do we know how many dropouts because of teenage pregnancy, rape, or incest? Do we understand the negative impact on productivity and capacity for innovation? Education and research, therefore, are also aspects of the FPAT's mandate.
The FPAT president says as the legal and policy framework is being addressed across different platforms, her organization is bringing training which will improve understanding of the various problems.
In the meanwhile, FPAT is rolling out its comprehensive sexual education project, which will equip young people with knowledge and skills to better understand the responsibilities and risks associated with their sexual and reproductive health. It also provides teachers with information specifically tailored to build their capacity, contributing to their effective engagement with young people.
Professor Antoine says already they have had workshops with private schools and youth organizations and only await government schools' input as they organize a curriculum and plan to move forward in 2018. Funding is a challenge, she says, which FPAT has taken on in order to achieve a sustainable flow of financial support for improving sexual and reproductive health in the Caribbean. Marie-Therese Bernard, CNews.